So can we talk a little bit about prevention and lifestyle? Are there any lifestyle changes people can do to help further damage from happening in their kidneys, like diet, exercise?
Yes, I think that is very important. And I think that we're hoping to put more and more focus on the preventative parts. So making sure that you have a good diet. So diet is very, very important. Foods that are highly processed are going to give you all of the salt and the phosphorus and things that are just not good for the body. So diet is very important, making sure that, it's a balanced diet. People always ask about protein. I'm not supposed to eat protein. That is not what we say, because obviously your body needs protein, but it's important to have a balanced source of protein. So more and more information and recipes are coming out so that we can use plant-based protein. There's lots of amazing options about getting protein through plant-based foods. So making sure that the diet is just balanced, so it's not heavy on the animal products, that we do have some plant-based proteins, and just making sure that, the right amount of vegetables and just healthy food. There's lots of resources out there. I always refer people to the BC Renal Agency website and to go and look at the diet parts, and there's lots of good recipes there. So kidney-friendly diet, which is honestly just a friendly diet, right? It's good for your heart, it's good for your blood vessels, preventing strokes, preventing heart attacks. It's the same thing. So making sure a healthy diet, and then making sure that you do have some exercise as well, so that even if it's just 30 minutes of walking, it doesn't have to be major exercise, but incorporating that into your daily lifestyle is very, very important. And just making sure that you follow up on checking on certain things. We're often like, oh, my blood pressure is only borderline elevated, and that's just not good. So making sure we get onto, in charge of that. And sometimes by just improving your diet, reducing, getting some more exercise, blood pressure improves, and you may not even need medication, but making sure we stay on top of that. Those are the big preventative things.
We often get calls here at the foundation about diet and confusion, right? And people are scared. Can you talk a little bit about when it is that patients would have to start managing potassium and phosphorus, and at what percentage perhaps that would be?
Very good question. So when we talk about phosphorus, sometimes high phosphorus diet is because there's a lot of preserved foods that's in the diet, and that should be prevented from right at the beginning, because that's just going to cause damage no matter what. But then there's phosphorus in healthy foods like dairies, nuts, some vegetables that are higher in phosphorus, and that's okay. Becomes more of a problem as the kidney function starts to drop below 20%, is when the kidneys are having difficulty actually now excreting that phosphate load. So that's when, we like for patients to have access to dietary counseling, so that we can say, okay, keep eating a little bit of this, but maybe you're having a bit too much of this other thing. Maybe we need to cut that down a bit, because your phosphorus is starting to go up, because the kidneys just can't clear it. But it is important to have dietary counseling, because you don't want to reduce some of the really healthy foods. Definitely get rid of the preservative type of high phosphate foods. Potassium, again, it's different with different patients, but usually, again, when your kidney function drops below the 15% and the kidneys are not able to do the balancing, is when you need to start to look at potassium restriction and watching that. Some people a little bit earlier at 30%, depending on what type of kidney disease they have. Sometimes people with diabetes have certain condition in their kidneys and they cannot get rid of the potassium as well. Or you're on medications that are good for you and are important for you. Some blood pressure medications retain potassium a little bit. That's just one of the things that happens with certain blood pressure medications. We don't want to get rid of that blood pressure medication because it's good for the kidney. So then we have to make sure that there's a little bit of dietary restriction of potassium. But again, under dietary counseling, because so much good food does have potassium, it's just we don't want to go too much on one side. So that's usually when people start to need to be restricted a bit more, usually when it's less than 20%.
So you mentioned BC Renal as a resource. Are there any other resources you might recommend to the kidney patients to access for advice or support, especially on diet and exercise, even mental well-being and socially connecting?
There is a number of different websites that people can look at for, again, just looking at healthy diet. So I usually tell people to first go to the BC Renal Agency website, and then after that maybe go on to some other dialysis websites and just look at recommended diets, or some sharing of information between patients, because sometimes that can even be more valuable. So usually I just tell people to Google it, and because some people find it difficult to just go and access other things and rather than just using the internet. But there is a lot of websites that do actually give some general, not too detailed, but good information about, what are some foods that, how do you prevent salt? Maybe add these kind of spices that would give it the same flavor, but not, you don't have to use salt, sodium. Don't replace salt with potassium, because that's now going to cause a problem. So, maybe replace it with some other spice stuff. So I think that there is a lot of information out there, but that's usually the first places that I tell people to go to, not to give them too much.
Fair enough. And I know you're aware of the Kidney Wellness Hub, but did you know the Kidney Community Kitchen has been around a long time, supporting patients with recipes and tips, as well as access to dietitians? They can submit questions.
I'm glad you brought up, because I don't think everybody's aware about that, so that to be able to refer people to this site. So, but I definitely will moving forward.
Perfect. That's amazing.